Dr. Collier, good morning.
Good morning, Ricky Smiley, and thank you once again for the opportunity to bring healthcare information to the listeners of
Answer
the Ricky
your phone,
Smiley
Dr. Collier.
Morning Show.
Answer your phone, Dr. Collier.
Get it, Brett.
Dr. Collier, answer your phone, Dr. Collier.
Dr. Collier, Dr. Collier.
Yes.
Dr. Collier. Brett,
Yes, sir.
Brett had to sit on my back this morning, and you found a knot in my back.
Yeah, he had a knot in his back. He was real tense and couldn't hardly move, walking around here like an 80-year-old man.
What is that, Dr. Collier?
Probably be a sebaceous cyst. It could be a lipoma as well. We'd be happy to take a look at it, Ricky.
A what?
You know, we remove those in the office, not a problem.
Why couldn't just be a tight muscle?
It could be that as well.
He said a what?
He was walking around like an old man, and it could be muscle. I think Ricky complained of some muscle spasms in his back after sleeping on the couch. So so it could be that as well. But it could be a big cancer lump, and you could be gone in 6 months.
Damn, damn, Dr. Collier.
Just got dark. I'm just telling y'all what it got dark.
Dang.
I thought it was gas, but
I'd rather gas or a muscle cramp than a...
Everything ain't gas, Gary.
Everything ain't gas, Gary. So Ricky, our topic today is cancer prevention, and the question is, does vitamin D prevent cancer or lower the risk of dying from cancer? So when it comes to the effects of vitamin D on cancer, all scientists do agree that vitamin D is generally not low vitamin D or vitamin D deficiency is generally not a good thing. Adequate levels of vitamin D are important, and according to laboratory studies, vitamin D deficiency seems to help certain cancers develop. Studies found that people living in southern states where sunlight exposure is high were less likely to develop or die from certain cancers than those living in the north. Because exposure to sunlight leads to higher productions of vitamin D, it was thought then, okay, let's look and see if variations in vitamin D levels might account for the cancer variations that we see. So high levels of vitamin D have consistently been associated with reduced risk of colorectal cancer and bladder cancers. And studies have shown that lower vitamin D levels are associated with higher overall cancer mortality. So people with low vitamin D get higher levels of cancer and die from cancer more often. So there was an analysis of 4,000 cases, Ricky, that included prostate cancer, lung cancer, colorectal cancer, and ovarian cancer. And they found that there was a 17% lower cancer mortality among men and women and those with higher vitamin D levels, and that those with low vitamin D levels had poor prognoses. So this is also the fact that cancer therapists and cancer itself have a tendency to lower bone mass and cause osteoporosis. So maintaining good vitamin D levels are good. So how do you know you have a vitamin D deficiency? How do you get vitamin D naturally? People always ask me that question. Unfortunately, Ricky, very few foods commonly consumed in our diets contain vitamin D naturally. There are things like breakfast cereals, amazingly enough, and milk that have vitamin D supplements in there, and they can help. But as we age, our skin becomes less efficient at making vitamin D from sunlight. So most people that I'm testing in my practice, I would say 8 or 9 out of 10 have vitamin D deficiencies. So what do you need to do? You need to take vitamin D supplements at a therapeutic dose. The recommendation has traditionally been 5,000
international units of vitamin D every single day for the rest of your life if you over the age of 25. Am I right or wrong, Dr. Collier?
You are absolutely correct, sir. So we need to get these cancer rates down and see it can help you treat and makes cancer therapies work better. So if you are diagnosed with cancer, one of the first things they will do is put you on vitamin D because it makes virtually every type of cancer therapy work more efficiently. So vitamin D is a very simple and elegant way, if you keep those levels up, that reduce your risk of getting those cancers that we listed.
And if anybody wants 5,000 international units of vitamin D every day, go to lipodrops.com. That's Dr. Collier's own vitamin. I take them every single morning. About to take mine now. Lipodrops.com. Let's go to the phones. Good morning.